Which type of anemia most commonly seen during pregnancy? A. Sickle cell anemia. B. Microcytic anemia. C. Physiological anemia. D. Hemolytic anemia. Correct answer is option C. Physiological anemia. The patient has the diagnosis of left ventricular failure and a high pulmonary capillary wedge pressure. The physician ordered dopamine to improve ventricular function. The nurse will know the medication is working if the patient is A. Blood pressure rise, B. Blood pressure decrease, C. Cardiac index fail, D. PCWP rise. The correct answer is A. Blood pressure rise. Identify the following device. A. Goodal airway or oropharyngeal airway. B. Laryngeal mask airway. C. Nasopharyngeal airway. D. Tracheal airway. The correct answer is option A. Goodal airway or oropharyngeal airway. Identify the following device. A. Humidifier. B. HM filter. C. Nasopharyngeal airway. D. Tracheal airway. The correct answer is A. Humidifier. Which category of ICD is associated with schizophrenia? A. F2229, B. F4249, C. F0209, D. F3239. The correct answer is A. F2229. Identify the following maneuver that is illustrated in following image. A. Heimlich maneuver. B. Ringtone maneuver. C. Headlift chin maneuver. D. Juvenile maneuver. The correct answer is A. Heimlich maneuver. What is the normal central venous pressure in adult? A. 3 to 10 cm H2O. B. 0 to 20 cm H2O. C. 8 to 15 cm H2O. D. 5 to 20 cm H2O. The correct answer is C. 8 to 15 cm H2O. Name of the instrument. A. Cord cutting scissor. B. Stitch removing scissor. C. Cocker forceps. D. Tooth forceps. The correct answer is option C. Cocker forceps. Look at the below given image and identify the correct type of bridge presentation. A. Frank bridge. C. Complete bridge. B. Footling bridge. D. None of above. The correct answer is option B. Footling bridge. Well, installing eardrop in the adult client, then pin of the ear should be pulled. A. Upward and forward. B. Downward and forward. C. Downward and backward. D. Upward and backward. The correct answer is option D. Upward and backward. Innermost layer of GIT tract formed by A. Epithelium tissue. B. Nervous tissue. C. Connective tissue. D. Cardiac tissue. The correct answer is option A. Epithelium tissue. Identify the mask that given in the following image. A. BiPAP mask. B. Face stent. C. Venturi mask. D. NRBM mask. The correct answer is A. BiPAP mask. Abasia is seen in A. Conversion disorder. B. Depression. C. Mania. D. PTSD. The correct answer is A. Conversion disorder. The false belief that irrelevant occurrence or details in the world related directly to oneself is known as A. Idea of reference. B. Delusion of nihilism. C. Erotic delusion. D. Depression. The correct answer is A. Idea of reference. Naloxone challenge test is used to assist A. Mental dependence of opioids. B. Physical dependence of opioid. C. Socially dependence of opioids. D. To assess residual serum level of opioids. The correct answer is B. Physical dependence of opioids. Which disinfectant used to disinfect HIV patients' bedsheet and linen? A. 5% glutaldehyde, B. 10% glutaldehyde, C. 2% glutaldehyde, D. 1% glutaldehyde. The correct answer is C. 2% glutaldehyde. A neurotransmitter mainly involved in OCD is A. Serotonin, B. GABA, C. Dopamine, D. Norepinephrine. The correct answer is A. Serotonin. Which chapter of IMHA 2017 is related to right of persons with mental illness? A. Chapter 2, B. Chapter 5, C. Chapter 11, D. Chapter 3. The correct answer is B. Chapter 5. Which of the following is a common defense mechanism observed in obsessive compulsive disorder? A. Reaction formation, B. Magical thinking, C. Regression, D. Progression. The correct answer is A. Reaction formation. Preservation is A. Seen in OCD, B. Persistence and inappropriate repetition of same thought, C. Characteristics of schizophrenia, D. Feeling of distress in patients with schizophrenia. The correct answer is B. Persistent and inappropriate repetition of same thought. Geneva and Tenders Adhanom is correlated to A. Headquarter and President of WHO, B. Headquarter and President of UNICEF, C. Headquarter and President of ILO, D. Headquarter and President of UNO. The correct answer is A. Headquarters and President of WHO. What is the most common serious side effect of the drug chloramphenicol, especially in neonates? A. Bronze baby syndrome, B. Red baby syndrome, C. Grey baby syndrome, D. Common baby syndrome. The correct answer is C. Grey baby syndrome. Acetyl salicylic acid should be avoided in which condition? A. Viral fever, C. Bacterial fever, D. Headache, B. None of the above. The correct answer is A. Viral fever. Look on the following image and identify that which parameter can be assisted by this instrument. A. Cardiac rhythm, B. Uterine rhythm, C. Fetal heart rate, D. Uterine tone. The correct answer is C. Fetal heart rate. Route of BCG vaccine: A. Intramuscular, B. Subcutaneous, C. Intradermal, D. Intravenous. The correct answer is C. Intradermal. A client with history of chronic hypertension and edema, admitted in ICU since 15 days, is getting loop diuretic from 2 days. During the rounds, unit head doctor asks his junior that which electrolyte imbalance occur if loop diuretic care taken long time. Then junior doctor's response will be A. Hypernatremia, B. Hyponatremia, D. Hyperkalemia, C. Hypokalemia. The correct answer is B. Hyponatremia. Identify the wire-like structure in the following image. A. Hernial mesh, B. Absorbable cover sheath, C. Collagen sheath, D. Transparent gauze. The correct answer is A. Hernial mesh. Identify the following therapy. Option A. Negative pressure wound therapy. Option B. Psychotherapy. Option C. Rewarming therapy. Option D. Muscle stimulator therapy. The correct answer is A. Negative pressure wound therapy. Identify the following instrument. A. Sims speculum, B. Alice forceps, C. Cusco speculum, D. Doyne's retractor. The correct answer is D. Doyne's retractor. Identify the item in below image. A. Cuffed ET tube, B. Cuffed tracheostomy tube, C. Uncuffed ET tube, D. Uncuffed tracheostomy tube. The correct answer is B. Cuffed tracheostomy tube. Identify the green colored waveform in below the picture. A. IBP. B. Pulse rate. B. NIBP. D. Oxygen saturation. The correct answer is B. Pulse rate. Identify the following instrument. A. Artery forceps. B. Mosquito forceps. C. Sponge holding forceps. D. Chittle forceps. The correct answer is D. Chittle forceps. Which anatomical plane showing in the picture? A. Transverse plane. B. Sagittal plane. C. Coronal plane. D. Frontal plane. The correct answer is B. Sagittal plane. Which gas filled in the blue color coded vaporizer anesthesia machine? A. Isoflurane. B. Desflurane. C. Sevoflurane. D. Halothane. The correct answer is B. Desflurane. The child says that there is beer inside the room. The nurse using the light see that there is a folded towel placed on the chair. Child experience from A. Hallucination. B. Illusion. C. Delusion. D. Depression. The correct answer is B. Illusion. A patient is arriving in emergency department after severe hemorrhage. Sister in charge told nursing sister cannulization quickly. In the following cannula, which will provide highest amount of fluid to prevent shock? A. 22 gauge. B. 20 gauge. C. 18 gauge. D. 16 gauge. The correct answer is D. 16 gauge. What is the priority nursing action immediately after patient experience a seizure? A. IV fluid. B. Open airway. C. Physical safety. D. Physiological support. The correct answer is B. Open airway. Which personal protective equipment should be used when providing wound care to patient with a MRSA infection? A. Gloves and gown. B. Mask. C. Gloves. D. Gown. The correct answer is A. Gloves and gown. Movement of the soul towards the median plane is known as A. Abduction. B. Eversion. C. Inversion. D. Extension. The correct answer is C. Inversion. Drug of choice in anaphylactic reaction is A. Atropine. B. Epinephrine. C. Digoxin. D. Dobutamine. The correct answer is B. Epinephrine. An unconscious patient moves his extremities spontaneously, open airway with verbal response, and speak inappropriate words. Then what is the GCS? A. 10. B. 12. C. 11. D. 8. The correct answer is B. 12. What is the national currency of UK? A. Dollar. B. Pound. C. Rupees. D. Yen. The correct answer is B. Pound. Mountex test is used for A. Screening test for asthma. B. Screening test for COPD. C. Screening test for emphysema. D. Screening test for tuberculosis. The correct answer is D. Screening test for tuberculosis. Pap smear test is used for A. Screening test for cervical cancer. B. Screening for ovarian cancer. C. Confirmation for cervical cancer. D. Confirmation for ovarian cancer. The correct answer is A. Screening for cervical cancer. Identify the abnormalities of ECG paper given below the image. A. Ventricular fibrillation. B. Atrial fibrillation. C. Ventricular tachycardia. D. Atrial tachycardia. The correct answer is D. Atrial tachycardia. A patient is admitted to the ICU on mechanical ventilation. Suddenly, the high pressure alarm is triggered due to blockage of endotracheal tube. What is the appropriate action? A. Immediately do the suction. B. Remove the ET tube. C. Manually ventilate the client with ambu. D. Inform the on-duty doctor. The correct answer is A. Immediately do the suction. A patient continuously receiving TPN, which parameter should be monitored closely? A. Vital signs. B. Consciousness. C. Electrolyte level. D. Blood sugar level. The correct answer is D. Blood sugar level. After RTA, a patient come into emergency department with massive blood loss. Which color cannula used by a prudent nurse to administer large amount of fluid or blood? A. Gray. B. Green. C. Blue. D. Pink. The correct answer is A. Gray. A sign of pregnancy consisting a dark bluish or purplish red color of the vaginal or cervical mucosa as a result of increased blood supply to the area is known as A. Oceander sign. B. Goodall sign. C. Chadwick sign. D. Jaeger sign. The correct answer is C. Chadwick sign. A client is receiving TPN in ICU from 8 am. In the next day at 8 am, on-duty nurse noticed that there is 200 ml solution left in the bag. Which action is appropriate? A. Discard the left solution and reconnect a new TPN bag. B. Note the findings in client notes. C. Immediately inform to the on-duty doctor. D. Observe and recorded all vitals. The correct answer is A. Discard the left solution and reconnect a new TPN bag. Storage temperature of fresh frozen plasma. A. Minus 30 degrees Celsius. B. Minus 15 degrees Celsius. C. Plus 15 degrees Celsius. D. Plus 30 degrees Celsius. The correct answer is A. Minus 30 degrees Celsius. Which of the following function of fallopian tube? A. Ovum production. B. Implantation. C. Sperm production. D. Fertilization. The correct answer is D. Fertilization. Which anti-tubercular medication cause orange-red color in urine? B. Rifampicin. D. Streptomycin. A. Isoniazid. C. Pyrazinamide. The correct answer is B. Rifampicin. Drug of choice of withdrawal symptoms of alcoholism. A. Benzodiazepines. B. Olanzapines. C. Clonazepam. D. Phenoptine. The correct answer is A. Benzodiazepines. Triaxiphenidil act as A. Anti-Parkinsonism. B. Anti-malarial. C. Antipsychotic. D. Anti-manic. The correct answer is A. Anti-Parkinsonism. Patient arrived at emergency after road accident. Pulse rate is 127. Blood pressure is 90/56 with cold extremities. Which type of shock may occur? A. Neurogenic shock. B. Spinal shock. C. Hypovolemic shock. D. Cardiogenic shock. The correct answer is C. Hypovolemic shock. Name of the given position. A. Reverse Trendelenburg position. B. Trendelenburg position. C. Counter Trendelenburg position. D. Supine position. The correct answer is B. Trendelenburg position. A patient's ABG report shows the following values: pH 7.55, PaCO 30 mm of Hg, HCO 27 ml per liter. What is the most likely? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Metabolic alkalosis. The correct answer is A. Respiratory alkalosis. Normal serum potassium level is A. 3.5 to 5.5 ml per liter. B. 135 to 145 ml per liter. C. 135 to 145 ml per liter. D. 8 to 10 ml per liter. The correct answer is 3.5 to 5.5 ml per liter. A nurse find a patient collapsed during a ward rounds. What is the initial nursing intervention? A. Check pulse. B. Notify physician. C. Start oxygen. D. Start CPR. The correct answer is A. Check pulse. LMP is 12 July 2018. Then what will be expected date of delivery? A. 19 July 2018. B. 19 July 2019. C. 21 May 2019. D. 19 April 2019. The correct answer is D. 19 April 2019. Identify the following image. A. Closed suction catheter. B. Handheld manometer. C. Feeding tube. D. ET tube. The correct answer is A. Closed suction catheter. Look on the following denote image and identify the grade of pressure zone. A. Grade 1. B. Grade 2. C. Grade 3. D. Grade 4. The correct answer is B. Grade 2. Identify the position given in the below image. A. Prone position. B. Supine position. C. Dorsal position. D. Sniff position. The correct answer is C. Dorsal position. In which of the following disease is silent myocardial infarction most commonly seen? A. CVA. B. CKD. C. DM. D. HTN. The correct answer is C. DM. Which of the following minerals should be given to a client suffering with diarrhea to prevent severity of disease? A. Magnesium. B. Iron. C. Calcium. D. Zinc. The correct answer is D. Zinc. What is the leading cause of cognitive impairment in old age? A. Malnutrition. B. Loss of cardiac reserve. C. Stroke. D. Alzheimer's disease. The correct answer is D. Alzheimer's disease. If highest temperature recorded in the morning and lowest temperature in the evening, this type of fever is known as A. Inverse fever. B. Remittent fever. C. Lysis. D. Crisis. The correct answer is A. Inverse fever. A client is scheduled for blood to be drawn from radial artery for an arterial blood gas determination. The nurse assists with performing Allen test before drawing the blood to determine the adequacy of which A. Ulnar circulation, B. Femoral circulation, C. Carotid circulation, D. Brachial circulation. The correct answer is A. Ulnar circulation. Which of the following is not the sign of angina? A. Chest tightness. B. Generalized body pain. C. Jaw ache. D. Chest pressure. The correct answer is B. Generalized body pain. Which electrolyte imbalance occur in the water intoxication? Option A. Hypokalemia. Option B. Hyperkalemia. Option C. Hypernatremia. Option D. Hyponatremia. The correct answer is C. Hypernatremia. Anti-sensitivity test should be done via intradermal route because A. It diffuses quickly. B. Easy to administration. C. It is diffused slowly. D. It is less painful. The correct answer is A. It diffuses quickly. A nursing officer is suctioning oral secretion in a unit. What is the maximum suction pressure that should be applied? A. 100 to 120 mmHg. B. 50 to 100 mmHg. C. 120 to 150 mmHg. D. 60 to 80 mmHg. The correct answer is D. 60 to 80 mmHg. Tramadol is an example of A. Antiemetic. B. Antipyretic. C. Opioid analgesic. D. PPIs. The correct answer is C. Opioid analgesic. Identify the following instrument. A. Doyne's retractor. B. Alice forceps. C. Deaver's retractor. D. Episiotomy seizure. The correct answer is D. Episiotomy seizure. Which of the following is a non-modifiable risk factor for hypertension? A. Obesity. B. Atherosclerosis. C. Age. D. High salt intake. The correct answer is C. Age. What is the typical length of an 18 French Riles tube? A. More than 100 centimeter. B. 50 centimeter. C. Less than 50 centimeter. D. 70 centimeter. The correct answer is A. More than 100 centimeter. A client is admitted in the hospital with complaint of GERD. Which position should be preferred to the client to reduce the severity of disease? A. Semi-fowler position. C. Foot end elevation. B. Prone position. D. Supine position. The correct answer is A. Semi-fowler position. What is the most common adverse effect of adrenaline? A. Bradycardia. B. Tachypnea. C. Tachycardia. D. Bradypnea. The correct answer is C. Tachycardia. Morpheus sign seen in A. Tachycardia. B. Bradypnea. C. Cholecystitis. D. Pancreatitis. The correct answer is C. Cholecystitis. When monitoring an IV site and infusion, a nurse note pain at the axis site with erythema and edema. What is the grade of phlebitis would be nurse document? A. Grade 1. B. Grade 2. C. Grade 3. D. Grade 4. The correct answer is B. Grade 2. Which is an Indian Space Agency? A. ISRO. B. RBI. C. NASA. D. CBI. The correct answer is A. ISRO. Which food item should be advised to a pregnant lady for folic acid? A. Green leaf vegetable. C. Whole grains. B. Milk and dairy products. D. Pulses and meats. The correct answer is A. Green leaf vegetables. Which pulsate is assessing in the following image? A. Carotid. B. Temporal. C. Parietal. D. Facial. The correct answer is B. Temporal. Which of the following test is specific diagnostic test for disseminated intravascular coagulation? A. PT-INR. B. D-dimer. C. Bleeding time. D. Clotting time. The correct answer is B. D-dimer. BMI for underweight. A. Less than 18.5. B. 25 to 29.9. C. 18.5 to 24.9. D. More than 30. The correct answer is A. Less than 18.5. A nurse is explaining the rationale for performing leg exercise after surgery. Which region should be included in the explanation? A. Promote respiratory function. B. Maintain functional ability. C. Provide diversional activity. D. Increase venous return. The correct answer is D. Increase venous return. A 31-week pregnant lady come into the emergency department. A fetal fibronectin test is performed and result got positive. A positive fetal fibronectin test is indicate to A. APH. B. Prolonged labor. C. Preterm birth. D. Precipitous labor. The correct answer is C. Preterm birth. Which of the following vitamin deficiency cause pernicious anemia? A. Vitamin B1. B. Vitamin B12. C. Vitamin B3. D. Vitamin B6. The correct answer is B. Vitamin B12. A doctor ordered to nurse to give 400 ml fluid to be given on 8 hours. Drip factor is 60 drop per minute. The assigned nurse will be run this at what flow rate? A. 13 drops per minute. B. 30 drops per minute. C. 50 drop per minute, D 40 drop per minute. The answer is C 50 drop per minute. ECG change in hyperkalemia condition includes A. Prominent U wave, B. Shallow T wave and ST segment depression, C. QRS complex wide, flat P wave, tall peaked T wave, D. Prolonged PR interval. The correct answer is C. QRS complex wide, flat P wave, tall peaked T wave. Which of the following degree of burn is most painful? A. First degree, C. Third degree, B. Second degree, D. Fourth degree. The correct answer is B. Second degree. Doctor ordered to give 1000 ml of fluid NS at flow rate of 125 ml per hour. How much time it will take to complete this fluid? A. 8 hours, B. 6 hours, C. 10 hours, D. 4 hours. The correct answer is A. 8 hours. Which of the following most common side effect of clozapine? A. Neutropenia, B. Pancytopenia, C. Thrombocytopenia, D. All of the above. The correct answer is A. Neutropenia. Extra calorie needed during pregnancy. A. 500 kilocalorie per day, B. 300 kilocalorie per day, C. 800 kilocalorie per day, D. 400 kilocalorie per day. The correct answer is B. 300 kilocalorie per day. First vaccine developed against which communicable disease? A. Chickenpox, B. Measles, C. Smallpox, D. Rubella. The correct answer is C. Smallpox. What is the most common complication of intravenous therapy? A. Infiltration, B. Phlebitis, C. Infection, D. All of those. The correct answer is A. Infiltration. While giving CPR, which is the correct position of hand for compression? A. Lower half of sternum, B. Just below the nipple, C. Upper half of the sternum, D. Above the nipple. The correct answer is A. Lower half of the sternum. What is the normal CVP? A. 50 to 60 mmHg, B. 30 to 40 mmHg, C. 70 to 80 mmHg, D. 70 to 100 mg. The correct answer is C. 70 to 80 mmHg. The doctor has ordered 500 ml 5% dextrose to be administered for 5 hours. It should be administered using a burette set. The nurse has to set the drop per minute to deliver the appropriate amount. Calculate the flow rate. A. 100 microdrops per minute, B. 80 microdrops per minute, C. 100 macrodrops per minute, D. 80 macrodrops per minute. The correct answer is A. 100 microdrops per minute. In a newborn, suction should be done in a dash first, then dash. A. Mouth and nose, B. Nose and mouth, C. A and B both right, D. A and B both wrong. The correct answer is A. Mouth and nose. Which is the southernmost state of India? A. Kerala, B. Karnataka, C. Tamil Nadu, D. Pondicherry. The correct answer is C. Tamil Nadu.